Hello and welcome to the second installment of our webinar series, Conversations on Substance Use During COVID-19 with Foundry Virtual. My name is Paige and I'm a youth peer supporter, and I will be facilitating this event with Laura, who is a clinical counselor on the virtual team. Before we begin, I would like to acknowledge that this presentation is taking place on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. So today we are joined by Dr. Steve Mathias, who is the Executive Director of Foundry. You will have the option to pose questions to Dr. Mathias throughout the live event using the Q&A function, and we will address any questions from the audience at the end. You can also turn on live captioning throughout the event if you would like to see subtitles. So our first question for Steve is, how did Foundry get started?
That's it's a big question. I'm not sure that that folks necessarily know this or are interested, but as I started off as a adolescent psychiatrist and was at Children's Hospital when I first graduated, and found that a lot of the young people who really needed help didn't seem to be coming to Children's Hospital because it was a bit of a it's in a very privileged neighborhood, and it's not always easy for young people to get there, and it's in a very secluded part of the province. And so decided to start working with young people who were homeless or really struggling by being precariously housed. And so started to work at Covenant House with a group of folks at St. Paul's Hospital, other psychiatrists. And over time, we came to really understand that a lot of the young people that we were seeing had come to downtown Vancouver from all parts of British Columbia. And many of them said the same thing over and over, that they wish they'd had help or had supports in place or folks to work with in their home communities, whether it was a small town in northern BC or an industrial community on the island. It just was really difficult for them to find help when they needed it. And many of them had said that they just, they'd go from one door to the next and couldn't really get the help that they wanted. So we decided to try something a little bit different by partnering with as many organizations as we could find who were working with young people at the time. And we started by having a housing component. So we started working with the housing providers and supporting young people who were living in housing, some of them living in for the first time in their own housing unit or their own home. And what we found was that there were just like so many gaps and struggle with folks to communicate with each other and get knowledge exchanged and an understanding of what young people needed. And so we really felt that we needed a home. We needed a one-stop shop. And that's when we first opened the Granville Youth Health Center, which was opened in 2015. So almost 6 years ago now. And when we opened it, we had lots of different folks working together, psychiatrists and family doctors, social workers, nurses, peer support workers for the first time. And it was a model that seemed to really work well. And we kept hearing that it was something that young people wish they'd had in their home communities. And so that's when we kind of put this proposal forward to government and really sort of suggested that we do this around the province. And so that's when we had our first call for interested communities, and that was in 2016, and we had 25 communities ask to do this model. We picked 5, and those were the first 5 that opened. So Kelowna, North Shore, Campbell River, Abbotsford, and Prince George. And then we opened another 5 after that, and now we're in the process of opening another 8. And over time, we keep learning from each center. How can we improve? How can we do things differently? Getting feedback from young people and their families. And that's really sort of where the center-based model started. And of course, all along, we felt that we really needed virtual care. And we really needed to be able to provide support for young people at times where they couldn't make it to their center, or when they were in communities that didn't have centers, or where they just didn't really want to leave their home. And we had pitched that idea back in 2015, and we kept pitching it every year. We kept saying, hey, we really need this, we really need this. And then finally this year, I guess with COVID, we were able to get the government to agree to fund a start on this concept, and that's really where the virtual care got started. So, in a nutshell, that's where we've been, and all along, the young people we were supporting early on, most of them were really struggling with some significant substance use concerns and issues, and I think we've always considered that to be a major component or a major service that we need to offer with Foundry. And I'm really proud of the fact that we continue to see some pretty innovative work, and we know that there's a lot of work to be done in this area, a lot of work that we can improve on, but it's a start anyway. And yeah, I guess that's why I'm here today.
Awesome, thank you for the intro. As Executive Director of Foundry, what are your perspectives on how youth who use substances are being impacted by the COVID pandemic?
I think that's a good question. I think there's probably some people who might be in the audience today who could really talk about that. I think everyone's different, aren't they? There's just so many different perspectives to think about. I think we need to think about young people who are living at home and where it's okay to smoke weed or to smoke cigarettes or to drink. They might even do it with their parents, and so they've got a relationship where it's a really transparent behavior. Or at the other end of the spectrum, young people who don't have a home at all and things are really unsafe for them, where they may be using substances, opioids that are putting their life at risk on a regular basis, or a young woman who's in an abusive relationship and for fear of being homeless is staying in that relationship and is using in ways that are potentially harmful, with risk of overdose. I think there's the whole spectrum, and I think so. I think that the pandemic has impacted a lot of young people who potentially may have used in groups of youth or had a set group that they used with, and now that group is much smaller, or they can't spend time with them. It may mean that young people are using in a lot more isolated conditions or environments. That's always my concern. Yeah, I cited at the very beginning, young people using with their parents. That's pretty rare. And so for the most part, most young people are using with other young people or on their own. And so the pandemic and the rules and restrictions that have come with that will have really impacted them, potentially. And as some of you may have heard already today, I think we're finding that we're even more locked down as of 3 o'clock this afternoon than we were before. So I think that the perspective I have is that we can't really have a general statement or a blanket statement on how everyone's being affected because it's so individualized, right? For some people, it hasn't impacted them at all. So it's just very different one person to the next. What I will say, though, is that anxiety and depression are up. And some studies show that anxiety is up, 4 times higher than before the pandemic. Depression may be 2 times higher. So it's entirely likely that a lot of young people are feeling a lot more anxious and a lot more depressed, and substances then may be playing a greater role in their lives as a way of coping. And again, that may not be what we're hoping for or what young people want, but it may just be the reality of the situation.
For sure. You'd mentioned for some youth that they might be more isolated, especially with all of the lockdown and restrictions coming into place. What are some ways that we can reduce that risk for youth that may not have those social supports or not as much contact with the people that they would be using with?
Well, I think as much as we can, letting those young people know that there's folks like us who are there and available to speak to and to support them if all they want to do is talk and or explore what's going on for them. I'm not sure how much we need to focus on changing behaviors at this point in time. I think what we really want to make sure is that people are safe, and that if they are using, that a greater harm's not going to come to them. So harm reduction, I think, is critical. Certainly, if young people, if a young person is wanting to address what's happening, or they feel like things are just getting a little bit out of hand or out of control, then it's a good conversation to have to explore that. I think for us, we need to make sure that as Foundry, as an organization, is viewed as a non-judgmental place, that we're open to having any kind of conversation, even if it's about the weather, as crappy as it is right now. And making sure that we're trying to find ways to, create diversions for young people, or distractions, ways that we can engage young people in fun conversations, games if we can, just dialogues about whatever young people would like to talk about, whatever interests them, and finding ways to connect. I know I've got some young people in my house, and we're connecting. We're baking a lot right now. I love baking as a way of distraction. It's probably not great on my risk factors, but we're really enjoying that, and it's one of those activities that certainly I wasn't doing before COVID, and I am doing now, and I think it's a great distraction for my kids. So it's just making sure that we remain connected, and that we try to strengthen our relationships if we can, as much as possible.
Love all the quarantine baking. Part of that was maybe answered for this question, but what could we be doing better as service providers during this time to help youth?
Oh, there's so much we could be doing. I think as much as we can, trying to keep that door open, I think is really important. Finding ways to stay connected, whether it's text messaging or basic chat, whether it's finding just the occasional moment in time where we can talk to someone and check in with them. I think that we can all improve our knowledge and understand what's going on for young people right now. Gaming is something that young people are doing a lot, and I totally get it. It's a way of connecting socially and staying, having a sense of community. And if that's what it takes, and that's what it takes at this moment in time, right? I think that we need to create messaging for parents that encourages them not to necessarily be really critical or judgmental of what's happening, and to be curious and explore. Same with teachers. I think so far I've seen significant shifts in teachers this year. I think they understand the pressures that young people are under, and I've seen just an amazing kind of approach by teachers around just encouraging young people to stay involved and attending school. I know that's not always possible, but I think that if we can work with teachers to keep kids and young people in school, I think that's really important. Especially if that's their social group. I know I've got a 13-year-old who's able to hang out with 25 other young people. It's a privilege for her to be in that position, but I don't want her to lose that. So I'm doing everything to make sure that they can maintain that cohort, because it's important right now for them. So I think also having school programs that are there for young people if school isn't working for them, making sure that we're not suspending young people, we're not moving them away from school, not diverting them. The last thing we want right now are for young people to become disengaged from school. And similarly, I think we really need very quickly to find ways for young people who may not be in work or employment, or may not be in training or in school, but are really kind of in that age group, 16 to 19 or 16 to 20, where they're not employed or not really actively in training, to have something to do, to be able to link back in to activities. So those are just some early ideas in terms of what we can do, but I think there's a lot more we can do.
Absolutely. Are there any ways that the provincial systems could be doing better to support people?
Yeah, I think that we need to improve or expand our access to provincial services in terms of counseling and supports. We need to improve our messaging. I think we need to be more accessible as leaders. I think we need to continue to work on destigmatization, but making it so that young people can have conversations that feel safe. We need to create those safe spaces, and if it's not in in real centers or real spaces, and it needs to be virtual. But we need to create those safe spaces for young people to talk about what their concerns are and ask questions in a way that's meaningful. I think in terms of our actual services, we can do a lot more to streamline things and to make sure that if a young person, for instance, needs to go to a detox, that detox is available in their community, and that there's an access point that's readily available, and that is actually connected to something. Too often I've seen young people go into a service like a detox or a day program, and it's just not connected to anything else, and so it's just from one wait list to the next, and I think that that's something that we can certainly improve on. It's actually not rocket science, but it does require people to work and talk together and work together and talk together, and it's just something that I don't think has happened enough in this province. And we've typically gone with these huge models of treatment in one part of the province where young people have to go there for like 6 to 7 months, and they have to come away from their family, and they don't really get to feel connected to their community. And I'm not sure that that's really worked terribly well. So I think we really need to think that through. We've been lucky that our last government has said that they're going to improve or increase our number of treatment beds. They're going to double them, so another 130. But I'd like to see that just be a little bit different, not the same model that we've done before, because I'm not quite sure that that's worked terribly well. We need to make sure that there's more aftercare. There's young people feel connected to their community when they are in treatment, and we have to make sure that parents are also getting access to the kind of support and counseling that they need, because it's too often we see young people kind of just be, I think, kind of scapegoated or identified as the problem, quote unquote, when really, it's the whole family really needs help, and they're lacking that. So, and I think right now, even if a young person doesn't want to go into treatment or get help, I think we really need to think about how we improve our harm reduction, how we improve our drug checking opportunities, their abilities. So many of the folks who have overdosed have done so accidentally. The toxic drug supply continues to be a problem. We're not going to address it anytime soon. So what can we do? We can make sure that there's a safe supply, and that there's more drug checking. And I think that that's something that we can do more immediately in the province. Does that answer sort of questions? Yeah.
Absolutely. And actually, similarly, our next question was, how is safer supply for people who use substances being impacted by the pandemic, from your perspective?
Yeah, it's a good question. I think it kind of depends on the substance that is being used by that young person. I think that the fact that we're not freely able to move around as much as we were before probably impacts things just in general. That wouldn't surprise me, and I think that that's pretty clear. But with alcohol, we still have access to alcohol like we once did. I think cannabis is probably very similar, but I think it's some of the other substances that are more problematic. And I don't think we have safe supply right now. Certainly don't have a safe supply chain, and the government has made a push to improve access to safe supply, and allow prescribers like me and nurse practitioners and nurses to prescribe medications that might substitute. But the reality is that a lot of the substances or the medications that we would use just aren't going to have the same effect. So if you're using certain drugs, you're not just, it's not a great substitution. So I think safe supply right now is still not really quite the term I would use. I mean, maybe safe substitution, but I'm not sure that we have the supply chain to really make sure that all of the substances are available. And I think that's problematic. That's problematic. I think that we're going to continue to work on trying to improve that supply chain, and to hope that we see folks using a safer substitution. But in the meantime, I think we have to continue warning young people and hopefully improve our drug checking, so that if young people are using certain substances that can lead to overdose, that they know what they're using.
Speaking to that, with COVID, it sounds like, from what I've seen stat-wise, that visits to drug checking or safer supply sites are down about like 50 to 60% during COVID. So what are some of those things that we could do right now to increase that chance of a safer supply or reduce that risk?
Yeah, that's a great question. I think getting into going beyond decriminalization, but thinking about, in some cases, making certain substances available, like you would any medication. Thinking about what that looks like and how you ensure that that's available, because drug checking isn't everywhere, and maybe we have to improve that as well. There's still a lot of folks who don't necessarily want to show up at a drug checking spot. It's not just because it's there doesn't mean you show up for it, and I think that that's something we have to keep in mind. There is a lot of substance use that happens spontaneously. It happens after a 6-pack of beer, or a 2-liter of cooler, and it just happens to be there, and you don't have time to drug check. So how do you ensure that what you're being introduced to is safe? And I think that that's something that I don't think that our current strategy is necessarily addressing. And I think the other thing too is, as physicians, we're being told two different things. We're being told to work on a safe supply for folks, and then at the same time to restrict access to opioids for others. And I think that's mixed messaging. And I think that we really have to wrap our head around the mixed messaging that's been happening, and make sure that physicians who can prescribe don't feel like they're going to be punished somehow for ensuring that there is a safe supply for their patient.
Awesome, thank you. Are there any future plans for substance use services at Foundry that you'd like to speak for?
Well, I think what we're recognizing is that we have a bigger role to play. We've got certain Foundry centers that I think all but one right now are opioid agonist prescribing. And we certainly have, I think we've had drug checking at Foundry Vancouver Granville, but I think that there are certainly services that I'd like to see expanded in improving our accessibility. I think our virtual care is just really discovering what we could be doing, and I think that that's really important to hear feedback and really ideas from young people who may want to make suggestions around how we could improve that, and also making sure that we have some folks who can prescribe who are part of virtual care. That's also important. I think that we have a role to play around educating teachers, educating non-substance use professionals, so counselors who may be mental health counselors but not trained in substance use. I think we have a role to play in educating parents and peer support as well, making sure young people can support each other. So I think there's lots to be done there, and I think we're just starting to scratch the surface and get a sense of what we could do.
So our next question is, how can young people access support at Foundry, regardless of their current use, readiness for change, and or with the goal of abstinence? And how do these services develop?
Sorry. I think I just want to be clear that our approach for Foundry has on the main been a harm reduction approach, and one where we have an open door to young people who are coming in. We know that we've had multiple, dozens and dozens of young people who still get help when they're intoxicated and under the influence, and that is absolutely fine. It is absolutely something that we believe in. So I think that that's something that we just want to highlight, that our doors open for young people in that respect. We also recognize that there may be a lot of other things that are priorities for young people, and substance use isn't one of them, and then that's okay too. And sometimes you're coming in to have a conversation about a job or housing, a conversation around your mental health, or an argument or a fight you had with a parent or a girlfriend or a boyfriend or a partner, and maybe that's your priority. And so just acknowledging that, we try to take as much as possible a non-judgmental approach. And that's my hope. That's what I hope our Foundry network continues to do. And if it's not happening, then obviously we have to have conversations around members of our network. But I think on the main, that's what our spirit is to try to have those conversations in a non-judgmental way. So having an open door, I think, is really critical. And I think that if a young person is struggling to show up in a center, then as much as possible, we want to make our virtual services available, and we need to continue to endeavor to make sure that our services are available on as short a notice as possible. And that's something that we understand. We're just getting virtual care off the ground, and we know that there can be some delays in access, and that's just something that we need to continue to look at. So, but there's absolutely a need to ensure that young people can get the help that they want when they need it or when they want it, and that work is still underway for us.
Our next question is, earlier in the year you were quoted as supporting the controversial Bill 22. Currently, the bill was put on pause for more consultation, and if the bill is brought back, would you still be in favor of this, and why?
Yeah, it's a good question, and it's a really difficult one because there's so many different perspectives for Bill 22. And for those who aren't aware, Bill 22 basically allowed a doctor, a physician, particularly working in an emergency room, to basically hold a young person who had just come in, typically because they'd overdosed, for 48 hours, to assess them and to see whether or not they could link them into a service. And if there was a second physician and they felt it was necessary or beneficial, that they could hold them for up to 7 days. And the reason I was supportive of the legislation is that I've seen a lot of abuse of the Mental Health Act, which allows for people to be held 28 days under the Mental Health Act for the same reason, which I think is really inappropriate, and not the original intention of the Mental Health Act. The Bill 22 was drawn up after quite a bit of consultation with communities, and particularly with parents and care providers who felt that they had only heard much after the fact that their young person had overdosed, had come into hospital, had been seen by physicians, had been discharged, and no one had been communicated. No parent was aware, no care provider was aware. And I think that in a couple cases that had led to unfortunate fatalities, so young people who had died when parents felt like they could have helped them. And I understand both sides of the story or the issue. I understand that many young people want to keep their substance use private. They don't want others to know. They don't want to engage with services. And so being held against their will is an issue for them. Conversely, I also understand that there are parents who are really concerned about their youth and don't have a way of breaking the pattern of interrupting, of giving that young person a chance to reflect on what's happened and what might be available. And similarly, I don't know that we've been able to do that or provide that for young people either, giving them a chance to take a moment, a couple hours reflect on what's happened and to see whether or not they want help. I don't think it was ever intended to force people into treatment. Let's be honest, 7 days isn't long enough to force someone into treatment. It wasn't intended to force them into detox. It was intended, though, to, I think, slow down what typically happens, which is a young person comes in on a Friday night, they've overdosed or found down, they're resuscitated, or they're sobered, and then, you know, at 9 o'clock in the morning, they're seen by a physician. The young person is just woken up. They don't really know where they are. They're scared, and then they're discharged. And that doesn't necessarily feel good for the physicians that are, or the social workers that are working with that young person. And it often feels like there aren't options available to them. And so Bill 22 was intended to try to provide opportunities for families and young people to get help. But the way it was rolled out, the way it was announced, I think clearly there wasn't enough engagement in leading up to it. And there were people who were very concerned. I know that we're not going to find a solution that everyone's going to be happy with. And so consensus is going to be very difficult. I think everyone's going to probably be somewhat unhappy with the outcome, but it's really important that everyone is heard when this is rolled out. And I don't think that was the case in this. That's my thoughts on Bill 22.
Awesome, thank you. Maybe we'll give a minute to see if any of the audience want to write anything in the Q&A, but anything kind of else that you want to speak to about COVID or substance use or youth and mental health, like anything else that sticks out for you?
Yeah, I think I'd just be really curious to hear what suggestions come to mind, whether it's through this webinar or through other conversations in terms of, you know, what are young people, what do young people think we should be doing as Foundry? We've certainly had some research projects where we've explored that with young people, which is really exciting, and we're getting some ideas there. We don't want to necessarily move in any particular direction until we've heard from our key stakeholders, the youth and families in this province, to hear what they think we should be doing. So let's get those ideas out and see what we can do to help.
For sure. I know the research project stuff is currently like in progress, but is there anything that sticks out to you so far that you can speak to?
I think that there's definitely a need to provide safe space for conversations. I think that that's really coming out for us. It's really critical that those spaces exist, and that young people feel like they can start to talk about substances in a non-judgmental way, whether it's in school or whether it's in their community. And I think that parents really need help too. I mean, I think that's something that we've, you know, I'm not sure if anyone's seen it, but you go into a restaurant or something and there's like these two guys who look like Bill and Ted's Excellent Adventure back from the early 80s. And they're like, if you don't talk to your kids, we will. And I really don't know what that means. And it's been put out by like the government, but I look at it and I just think, I'm not sure that's really hitting the mark. So like I think we can do better in terms of sitting down with parents and helping them have conversations that are meaningful, and also giving everyone a sense of what's safe. I'm always amazed when I walk into a liquor store and there's signs everywhere that talk about, you know, if you're pregnant, you know, you can harm your fetus or your baby by drinking. I think it's important that that messaging is there, but nowhere does it say what safe limits are. Nowhere does it say that for, you know, women, it's suggested that you don't consume more than 10 drinks in a week. If you're a male, you're not, you know, 12 to 14 is the limit that they recommend. Nowhere does it say that they recommend 1 to 2 drinks in a sitting if you're female, 1 to 4 for male. And that I mean, that's really basic stuff. And we haven't set safe limits for cannabis either. what should it be? Like, what should we be saying to folks in terms of cannabis use, right? So I think that there's a lot of work to be done still, and we can open the conversations up by putting clear messaging and seeing what people think and having discussions. I'm always amazed when I say to a young person, hey, do you know what safe limits are? It's not 30. You know, it's not 20 when it comes to alcohol consumption. And sometimes folks are surprised because their friends consume that much. And it's just really important for people to have a sense of what that limit is. Based on, it's not judgment or anything other than, you know, when you drink more than that, there's usually effects on your body that are really harmful over time. And that's why we make those recommendations. But for some reason, it's not published anywhere. So anyway, just like those types of things I think are really important to think about.
Awesome, thank you.
So I don't think that we've received any questions from the audience so far. So perhaps we'll just begin our closing. So thank you to everyone for coming to the webinar this evening. We really appreciate your attendance. And thank you so much to Steve for giving this wonderful presentation. I know I certainly learned a lot. I definitely heard the theme of connection as a really prominent theme that I heard in a lot of what you talked about, Steve, and it's definitely something that I'm going to take away in my work as a peer supporter. So thank you so much for all your thoughtful insights on these topics, and we will definitely be recording this presentation and adding it to the Foundry virtual website in the coming weeks. So if you weren't able to attend the full presentation, or you know people in your communities that you feel like would benefit from it also, it will be available online. So that concludes our event.
I just wanted to quickly note, I think Anne has a message there. I'm not sure if in the new, on the Q&A.
Thank you.
Yeah. What sort of training or dialogue can you suggest for us peer supporters at Foundry Virtual specific to substance use? And I think that that's a great question. And so one of the things that we have been developing is content for peer support as part of our Health Canada grant. So adding that content. There are also some online courses through the BC Centre for Substance Use. There's also the Justice Institute that's done that. But if you're a peer support worker at Foundry and it's something that you'd be interested in, I'm also happy to have that conversation as well. It's something that I've done and Lise Durante has done as well. So there's lots of folks on the team. Rick Dubras has done it too, quite a bit of education around it. So happy to take that back to the Foundry virtual team and find out what's missing and what you guys would like to learn more of, for sure.
Great. That's great for me to know also as a peer support worker, just to know that there's more opportunities for training available. I know Anne and I work on the same team, so we definitely appreciate being able to learn a little bit more about the topic. So, yeah.
Right.
Great. So if there's any other questions that anyone else would like to ask, doesn't seem like there are for the time being. Great. Well, thank you so much, everyone, for coming today. And yeah, unless there's anything else, I think we'll just conclude the event for this evening.
Thank you.
Great. Thank you so much. All right. Good night, everyone.